Good afternoon, everyone. It is so great to join you today. The last couple of weeks, we've talked with Dr. Kohif at Kohif Tailor Health and Kohif Pharmagenics about different aspects of our health and how precision medicine can help in the aspects of heart health and oncology. And today we come to another very special live Q&A. This is absolutely live right now on Cool FM Live, and we would love to have your interaction and your questions coming in regarding mental health. And we welcome Dr. Kohif to our broadcast today. Dr. Kohif, it's so great to see you, my friend.
Oh, hi, Jeff. Thank you. It's always thank you for having me first of all, and it always have it's always good to have you, and then thank you for the support for the community as well. It's very appreciated.
No, it's great. And since we're not able to be together, thank you for taking the time to see us via
Sure.
Zoom today. Let's talk about this. The last couple times we've gotten together, we've talked about how precision medicine can help with heart health, the cardiac health, and oncology with cancer care. And kind of summing up both of those, there's amazing ways, and we want people to go back and see those interviews. But today we're specifically looking at mental health, and that is something that has gone maybe under the radar for so many years, but has been brought into the mainstream and into the light for great reasons. I mean, we all struggle in areas of mental health, but precision medicine can actually help with that. So mental health treatment, Dr. Kohif, is often described as trial and error. And why does that happen? And how can precision medicine actually change that trial and error aspect of mental health care?
Sure, sure. First of all, mental health or psychiatry is very complicated. There are many reasons why. First of all, mental health conditions, such as depression and anxiety and many, many others, they are very complex conditions, as we call them, meaning they're not conditions that can be targeted with a single medication, right? Because first of all, there are a lot of factors that contribute to mental health conditions. I mean, we talk about genetics play a role, things like also like environmental exposure, um, lifestyle, stress, and many, many, many things. Lack of sleep and many, many, many other factors contribute to mental health, which makes it very difficult to treat. And that results, I would say, most of the time in trial and error approach when it comes to treating mental health. And one thing that's very important, Jeff, to mention also is, medications that are prescribed usually to treat mental health conditions such as depression and anxiety. For example, SSRIs and SNRIs. Usually, it takes 6 to 9 months at least to actually start seeing, I would say, response
Yeah.
to those medications. So, which makes it very, very difficult to treat those mental health conditions, and hence, the role of precision medicine. So, what precision medicine does is, it says, okay, instead of the trial and error approach, which sometimes takes months or even years, what precision medicine can help with, we can look at the individual or the patient, whatever they suffer from, in anxiety, depression, whatever it is. We can look at their whole profile and their genetics especially and see what's going on there. For example, there are things we can do when it comes to genetic tests or PGX. We can tell people if they're going to respond to the SSRI or NSI or antidepressant medication. This way we avoid that huge waste of time when it comes to trial and error. So, and there are many other ways as well, and so the genetics play a role, but also lifestyle and environmental exposure, right? I mean, it contributes a lot when it comes to mental health conditions. So this is why precision medicine is very important because it takes into consideration all these different unique characteristics instead of the one size fits all care that usually just you prescribe medication and then wait months to see what happens. No, precision medicine says, okay, you know what, we're gonna save you that time and the sufferings as well, not just the time and suffering, because these people go through pain by tailoring medications or treatment, not just medication, treatment overall, based on your unique profile. So.
I think that's a great explanation. And again, it's a live Q&A here. So if you have questions for Dr. Kohif regarding mental health and how precision care can work for you and with your current mental health providers, as well as using precision medicine, leave us a comment in the chat as we are live right now. Dr. Kohif, you kind of explained it about precision psychiatry and how it personalizes the treatment for the conditions like depression, anxiety, ADHD. Is it are you able to see those things from the cheek swab and the genetics
Yeah, yeah.
testings?
So genetics is a big part of what we do when it comes to psychiatry, of course. Again, because we can perform PJAX test to actually tell or inform what medications would work and avoid the trial and error and guessing. But also there are a type of genetic test we perform that can actually tell us if you have deficiency in certain things and markers in your body that might make you actually prone to develop anxiety, depression and things like that as well. So on both sides, I would say. So on the prevention side, there are some insights in place that we can perform, especially when it comes to genetic tests, to tell people if they have certain, deficiencies, and then we tell them, okay, well, this is exactly what you need to do in order to help your mental health overall. But also on the reactive side of things, we can tell people if they're already on medications, we can tell them what medication is going to actually work for them and what is not going to work, what medication will cause side effects, and what medication won't, and then combining it really with the other factors, the environmental exposure, the nutrition, herbs, and and all these other factors. So, I mean, that's when it comes to precision medicine. Those things are very important to take into consideration. We don't want to just reduce it into genetics, but yeah, of course, the genetics play a big role when it comes to psychiatry. But again, we want to look, at the whole picture that combines genetics, lifestyle, and environmental exposure as well. So,
And being able to look at those biomarkers and genetic insights, getting those and using those for the mental health medications that someone might be on, that can actually help those medications work faster for the patient, correct?
yeah, absolutely. Yeah. Because again, if you remember, we discussed that usually antidepressants, it usually takes 6 to 9 months at least for them to start working. So when you go to your doctor, usually they're going to prescribe you one of those medications. And then you're probably going to be told to wait. It's going to take time to work because, our brain is very complicated. It's not something that you can easily change. But yes, I mean, one thing that's also I think Jeff is important to mention here as well is based on the statistics, the psychiatric conditions in terms of response to those antidepressants, for example, at least 50 to 60% of those medications fail.
Wow.
Okay. Yeah. So 50 to 60% of patients do not respond well to these medications. Before we didn't know why, right? Now we have tools and insights that we didn't have before. We can actually look at your genetics, for example, and see why you're not responding to the antidepressant or the anti-anxiety or whatever it is, right? So that's very important to mention. So 50 to 60% of patients, based on most of the statistics out there, they do not respond well to antipsychotic meds.
So looking at that, thinking with basically the failure rate of medications in a possible majority of the times for patients who've tried several medications without success, how could that precision medicine improve their chances of finding that right treatment?
Yeah, absolutely. So first of all, if you're about to be prescribed a medication or if you're on medications already, we run some genetic tests that will cover psychiatric medications. I mean, I think the panel we have, they cover almost all those medications, probably SSRIs and SRIs. These are the two most common groups or family medicine groups when it comes to mental health and depression especially. So, I mean, I will give some examples to simplify it. So sometimes, some people are prescribed something like amitriptyline or nortriptyline, for example, or sertraline. And those medications usually are metabolized or processed in our bodies by some genes. And those genes produce enzymes in our liver. But anyway, so if you actually do not have those genes working or those enzymes working, what's going to happen now is those medications are going to build up in your system and cause severe side effects. And then a lot of those medications, they have very, very severe adverse reactions. I mean, you talk about suicidal thoughts and things as severe as that. So
Yeah.
it's very serious. So if they inherently those medications cause a lot of them cause suicidal thoughts and things like that. But let alone the fact that some patients do not actually process or metabolize those meds, so that actually puts them in higher risk to even develop those horrible side effects and such as suicidal thoughts and so on.
And
So
so, yeah, so this
yeah,
approach can actually help reduce those
yeah,
side effects that people experience with the
absolutely.
psychiatric medications.
Absolutely. To tailor, to reduce adverse reactions, side effects, to actually improve effectiveness and response to these medications as well. And avoid, again, the trial and error that when it comes to psychiatry, it takes 6 to 9 months at least, if not years. We have patients actually who come to us. They've been jumping from a clinic to another for years, literally,
Hmm.
and then they don't know what's going on. Why you're not responding to these medications while others do respond well to them, right? So now we know now your genetics could be contributing a lot to this, and also some other things like there is one thing we call phenylconvergence, meaning that when patients are taking multiple drugs together, or even taking them with some herbs. Um, One herb to mention here that's called St. John wort. That is an antidepressant. Like 80% of Americans probably take those medications, especially the young generation, because it's a supplement and it's good. But actually, that supplement interacts with almost all medications in the market. you
Hmm.
know? So imagine that you're taking that supplement and then you're also taking some antidepressant, for example, medications. And they're not working for you, and it's just because you're taking that supplement that's actually making it not working. It's making it ineffective. I mean, so yeah, so precision medicine can help, tailor care based on all this, your genetics, your medication profile, interactions, and so on.
It is a live Q&A here on Cool FM Live today with Dr. Kohif from Kohif Pharmagenics. For more information, of course, you can always check out kohifpharmagenics.com and get that 15-minute free consultation with Dr. Kohif and his team. And again, focusing on mental health today, and we'd love to have your questions in the chat. We've got an eye on the chat, keeping a close eye on that. So if you have questions about mental health or how precision medicine can help with that mental health journey, then leave those questions in the comments, and we will get to those as we are going over these particular questions here today. So, Dr. Kohif, how long does it typically take for a patient to benefit from this kind of personalized precision care treatment when it comes to mental health medications?
Yeah, so mental health medications, as we explained, usually it takes 6 to 9 months at least for the first medications to work. I mean, so with precision medicine, what we can do to reduce that time is when you know that, if, for example, if you have to wait 3 to 6 months to just say, at least you know that you're on the right medication. So it helps avoid, starting a new medication in 6 to 9 months and see what happens. And then again, starting another medication in 6 to 9 months if it doesn't work. And we see that. I mean, this is actually very clinically relevant. We see that in the clinic. So patients do not respond to medications, and it sometimes takes years until they figure out that, oh, this is why they're not responding. So I would say with precision medicine, we can limit it to 3 to 6 months. I would say, if not even, again, it all depends on the patient and then their unique patient profile. But I would say average 3 to 6 months, I would say, which again, if we look at the statistics, for example, it reduces that time that traditional healthcare, if you just, prescribe medications based on average patient, usually it takes 1 to 2 years, I would say, to be stable on an antipsychotic med. You might be, you might respond well to them, but you might not, right? We see this a lot as well. But precision medicine says, okay, let's wait before I prescribe a medication and experience all those horrible side effects and ineffectiveness as well. It says, okay, let's look at the whole patient profile and see what's going on in there. And maybe even before we prescribe medications, maybe there's something going on in there that's actually contributing to your depression or your anxiety, whatever it is, and we can fix it with some vitamins or supplements, for example. That actually happens sometimes as well. So we're not prioritizing medications all the time, by the way. The goal here is to help take people off medication as much as possible. But if they need one, then okay, it will be guided. At least they would know that probably their body is going to respond to that one well. So
And I think that comes down to the next question, which is who should consider precision psychiatry? Should it be only people who haven't responded to treatment or anyone maybe starting a mental health care regimen?
Yeah, I mean everybody. So
Yeah.
we're all about preemptive care in a way. So it's always nice to have those insights in place. So in case, just in case in the future, if you ever prescribe any of those meds, you know what works and what doesn't work for you. But I mean, we'll prioritize patients who are going through some reactive type of scenarios, the ones who are already been trying those medications for months or years, or the ones that are about to be prescribed. I would say definitely they want to go ahead. And again, it's all, as you mentioned, Jeff, it's a free 15-minute consult with us. We can look at their profile and everything, and then we'll discuss what best plan would work for them. So, but yeah, I mean, this is for everybody, especially the ones that are actually the ones who have experienced failures from those medications. So,
And that free 15-minute consultation is just one tap away right there on your smart device, or in the post description, you will find the link to kohifpharmagenics.com, and you will see the make an appointment free 15-minute consultation right there on your screen. And you can schedule that with Dr. Kohif and his team. Absolutely 15 minutes, absolutely free, and do that today. Dr. Kohif, how do your services work alongside the psychiatrists or primary care physicians to improve those treatment decisions? Because many people already have a primary care physician or someone that they're seeing
yeah.
for their mental health issues. How does Kohif come alongside them during this part of their journey?
Sure, sure. That's what we do all the time, actually. We say we provide, you can keep your provider, and we will provide the precision layer. If that makes sense. And we have a lot of, for example, primary care physicians, PCPs, and psychiatrists and specialists actually work with us. And there are many ways for us to work with them. They refer patients to us, and then we perform our precision medicine services and collaborate with them. After, we do, if we need to do a genetic test, and also combine the other factors in place. We usually, our specialists, generate some summaries and recommendations for the patients and their providers, so they can share with their providers as well. And sometimes we can hold like virtual telemedicine consult with the provider and patients as well, both of them. And then, our specialists will discuss, our recommendations also on that call with the provider and the patient as well. So, this is, I would say, the best scenario. But sometimes, patients just come to us directly. They book the 3-minute consult, and then they proceed with us. And then afterwards, we help them by providing some summary recommendations that they can take to their providers as well. Because, one thing to mention also, Jeff, is yes, this is psychiatry focused, but most of the time, even when we work with patients who are going through some mental health or any type of other conditions, I'd say, we also make sure to cover the other, I would say, areas to patients, already suffer from. For example, when a psychiatric patient comes to us, if they already see a cardiologist and they're on cardiology medications, we're definitely going to make sure that also to cover this, right? We're not going to work in silos. And this is something that's, I think, it's one of our missions and one of the challenges in healthcare. Is, sometimes patients see different specialists, they see cardiologists, oncologists, psychiatrists, pain management, and so on. And then each one of those specialists, most of the time, they just deal with their specialty and medications with their specialty, for example. We don't do that. So even if you come to a psychiatric patient, we're still going to look at the whole profile and make sure that if something needs to be done, we're going to be fix it, even if it relates to cardiology and so on. So
It's amazing to watch the teamwork come together
yeah.
with you and the patient who already has existing primary care physicians as well, being able to partner with them and help the patient along the way. And I'm sure you have examples of how precision medicine has helped a patient find more effective treatment plans, whether that be for the mental health aspect, for the oncology aspect, for the heart aspect that we've talked about these last several weeks.
Yeah. So I mean, we discussed them before, but for mental health, we have a lot. Actually, a lot of our patients are actually coming to us because they are on a lot of anti-psych meds. And one thing, here's what happens, Jeff, because again, we said that those medications, anti-psych meds usually, there is a big failure rate. So, patients, 50 to 60% based on the statistics, they usually experience failure to those medications. And this is why when they come to us, usually we see those patients on 10, 15 medications. And then I respect, those providers out there, physicians or nurse practitioners, when they approach us and asking us to collaborate with them, because again, it's a bad scenario, and then most of the time what happens is you prescribe those patients more medications, and this is why it just keeps adding more medications to their already, current medication list, and that's not good. So, for example, we had a patient like 2 weeks ago, and they came to us. It was referred by her PCP. It was, I think, Benson, I think. And then the patient was on 12 medications, I would say.
Mm.
So we performed some, our precision service, including the genetic test. And then when the genetic test results came back, and then, we did our analysis and assessment, we found out that actually 8 medications at least that this patient was not responding to, and he was actually on this medication for
Wow.
months. So we're able actually to take them off those medications, and then now they're only on 1 or 2 medications, and then we see some side effects going away, which is good. Well, now we're waiting for effectiveness, which is probably going to take 1 to 2, 3 months at least, as I say. But at least we were able to see some immediate change, and then we're looking for the long-term change as well. So they're just one medication. Now, kids and pediatrics as well. We actually have some kids sometimes they're on ADHD medications and they're not responding well to it. And we help those kids, and we have some, examples for kids who completely changed after they were, we told them, their healthcare provider, okay, the medication is not working for them, and we cut them down off a lot of medications, and then you see the impact, and even their teachers, school teachers. One of these shared with us one, mother shared with us that the teacher told her that the kid is completely different. So,
Wow.
I mean, because again, so one thing I want to highlight is mental health patients usually they are put on many medications, and most of the time they don't need a lot of those medications. You know,
And it's
so
great to think about the entire family. We're not just talking about a certain age demographic that might have mental health
yeah.
things that they're dealing with. But again, like you said, ADHD, anxiety, things that people of all ages, family members of all ages can experience, and there are answers. And this is a live question and answer segment here with Dr. Kohif live on Cool FM Live. Please feel free to leave your comments or questions in the comments section as we are live. Got a few more questions left before we wrap up here, Dr. Kohif. Maybe someone is watching this right now and feels like their current mental health treatment is not working. What would you recommend that they do?
Yeah, what I would recommend, there are two things I would recommend. First of all, I would advise them to talk to their provider, their specialist, psychiatrist, or whoever, and then discuss our services, or they can reach out directly to us. And then again, just book that free 15-minute consult. And we're more than happy, if patients sometimes bring their provider on that call. We're more than happy to do that as well. We have our HIPAA virtual, compliant HIPAA virtual platform. It has no limit. You can bring in whoever you want to, right? So this, I would say, so it's either you discuss it with your provider and your specialist, or you can actually book a free 15-minute consult with us, and we discuss, how our service and how they can support you on your mental health.
And I guess that begs the question, is precision medicine in psychiatry becoming more accessible for everyday people?
Um, I wouldn't say we're there yet. This is why that's our goal. That's why we exist. Because I mean, almost, I would say 80, 90% of patients at least, they still don't have access to such precision medicine services. And this is why, that's our goal really. And this is why actually, Jeff, we transition remotely because we thought that when we transition remotely would give us exposure to more patients, and then we'll make it more accessible to more patients. Yeah, but to answer your question, we're not there yet, especially the, traditional or standard healthcare. This is not implemented in place as a standard of care. But this is our goal again. So at Kohif Pharmaceuticals or Kohif Tailor Health, that's our job. Our job is to actually make sure to give people access to such services, and to improve the quality again, quality. So yeah, so but hopefully we will be able to get this to reach as many patients as possible throughout the US.
Well, like you talked about, I mean, you mentioned a patient in Benson, and obviously you serve
Yeah,
all of
yeah.
Cochise County, but being able to go through kohifpharmagenics.com. It is literally a worldwide effort
Yes.
that you're doing for people with precision tailored care at Kohif Tailor Health and kohifpharmagenics.com. Before we wrap up, I guess just one last question. Where would you recommend the viewers of this video who are watching right now, and maybe those who will be watching later on as this ends up circulating around Facebook and the internet and YouTube, where would viewers go to learn more about whether this approach might be the right fit for them at Kohif Tailor Health?
Yeah, sure. Just, they can just Google Kohif Tailor Health or kohifpharmaceuticals.com, and then they can go to our website. There are a lot of, I would say, information there. And then again, I would say the best way would be to have the educational session free, completely free. It's 15 minutes, but actually sometimes it takes 20, 30, or even more minutes sometimes, it takes more than 30 minutes sometimes. So again, it's all free. And then this is, I would say, the best way for them to learn about our services and our precision, about precision medicine overall. But yeah, they have our website as well. They can just Google Kohif Tailor Health, and then on the website there are a lot of information there. So
that's what we love about it. When people end up going in for that 15-minute consultation, it's not like there's a countdown clock up in the corner that is counting down and then all of a sudden everything is cut off. No, you do exactly what you need to in the amount of time, however long it takes. You say 15 minutes, but sometimes it can take a little bit longer, and that is absolutely free.
Yeah, and then because it all comes down to our name as well, Tailor Health. It's all about tailoring care. So some patients, they're not that severe. Even not just for the free 15-minute consult, but even the after the follow-ups consult, post-test results consult as well. I mean, they're tailored, and that's something I told my team honestly, and all the specialists. I told them, hey, if a patient needs an hour, it's okay. And at the end of the day, I would say financially, it's not enticing for us, but again, we're not. And because, we don't work with insurance companies, but, it makes us happy when we see people actually feel difference and they feel like they're getting answers they've been looking for. And that's what we're all about, honestly, here at Kohif Tailor Health. So yeah, so it depends on your situation. If you need 30 minutes, okay. If you need an hour, it's fine. If you need multiple sessions, we do it, So
And if you are looking for those answers, Kohif Pharmaceuticals is there to walk with you through that with your primary care physician and alongside of you during your heart, any sort of oncology issues or mental health issues that we've had the great privilege to talk with Dr. Kohif about over the last several weeks. So Dr. Kohif, thank you so much for taking the time to talk to us today about mental health and how Kohif Tailor Health can partner with us as patients along this journey.
No, thank you so much. And, it's always great to have you and talk to you. And again, thank you for the support for the community. We're doing this for the community. And, one thing I want to tell people is, which is probably, I always, it's like a reminder, is there is hope out there because I know people are frustrated with the current healthcare system, but there is hope. There are actually people out there who actually care about you, people who actually want to help you live, lead a better, healthier life. And I would say this is our mission here at Kohif Tailor Health. And then, Jeff, we're probably going to hold some other informative sessions as well, because again, education is key. And this is, part of our, I would say our job at Kohif Tailor Health as well. So
it is keeping the care
so
in healthcare.
Stay tuned, everybody, for, the next sessions.
Without a doubt, and it's just always a joy to see you. Thank you so much for taking the time to talk to us, Dr. Kohif. Keeping the care in healthcare, kohifpharmaceuticals.com. Tap in the post description to get that free 15-minute consultation with Dr. Kohif and his team to see how precision medicine, tailoring that precision medicine with your current health status can help improve your life along the way. Dr. Kohif, thank you again. Have a great day.
It's been a pleasure. You too.
And thank you for watching. Thank you so much for sharing this video around. Make sure that you tag your friends and family. We didn't have many questions in the live chat here, but if you have questions about how Kohif Tailor Health can provide that precision medicine for your mental health care along the way, make sure that you leave those in the comments section. Dr. Kohif, as well as the Cool FM Live team, will be keeping an eye on that throughout the next days and weeks ahead. But thank you for watching, and please share this video around. Let everybody know that tailored medicine, tailored health to you, genetic tailored health, is available at kohifpharmaceuticals.com with that free 15-minute consultation. Thank you for watching. Thank you for sharing. Have a great day, everyone. We'll talk to you again soon.